The theme for our session is managing non-communicable diseases. As we live in a world where lifestyle kills more than infection, and maybe briefly you can talk about what motivated you to become doctor. We have all three experts: Dr. Kumar Prabhash, Dr. Biplab Das, Dr. Yash Javeri. If it is okay with you, we can start with Dr. Kumar Prabhash, then we can move on to Dr. Biplab Das, and then Dr. Yash Javeri. Is that sequence okay with you?
Thank you.
All
Yes,
right.
sir.
Thank you,
So
sir. Good afternoon to everyone.
yeah, good afternoon. So before I request Dr. Kumar Prabhas to give his perspective of non-communicable diseases and what COVID has taught us more about non-communicable diseases. Dr. Prabhash is a professor of medical oncology at the world-renowned Tata Memorial Center. He has more than 2 decades of experience. He is president and convener of Indian Cooperative Oncology Network. He has more than 100 of scientific publications in various journals. He has been involved as principal investigators and co-principal investigator in more than 80 projects. He is proactive in creating awareness about lung cancer in the public, and he has successfully conceptualized lung cancer consortium for Asia, for whole of Asia. I will not go into more detail, Dr. Das, because that will take a lot of time. Your credentials are very, very, very strong. So give us your perspective on how do you look at NCDs and how COVID has exposed some of the weaknesses, the way we were dealing with NCDs in our country, and then maybe come back to why you chose to become a doctor, and then why did you choose this field. Over to you, Dr. Prabhash.
So starting with the COVID and NCD, and primarily what I'll do is I'll be focusing on cancer because that's what I practice, primarily. So COVID has had a huge disruption in the cancer care because whole focus has shifted from all other parts of the treatment to COVID. And what we have observed, especially in cancer patients, uh, in a big number of cancer patients, the window of opportunity to treat them and able to cure them, in many times it is smaller. And if we are not able to provide the treatment during these time to these patients, they in big number they become non-curable. Second part, what we observed, and this is one of our work which was done by our hospital part. You will be seeing many of these coming up. Are we able to deliver it? There has been a fear that if you have this COVID era, will be able to deliver the treatment without having those morbidity and mortality to the patient. Slowly, as we have been able to deliver more treatment, it appears it is possible to do these to the patients. And if we don't do it, it is good to look for the mortality which has happened with COVID. And if we do estimate that what kind of mortality can happen if you are not able to deliver these treatment to the patient, then we'll realize that this needs to go hand in hand. If we don't take care of these non-communicable disease, especially again I'll say I have experience of cancer patients, then we may lose many more patients with these disease as compared to COVID. That doesn't mean I'm undermining any way that COVID has to be a priority, but we should not lose focus on other non-communicable disease in this setting.
Thank you, Dr. Prabhash. That's a very good introduction. And you highlighted that COVID has had a huge disruptive impact on care of non-communicable diseases, especially cancer. And the window of opportunity we had for treating these cases was reduced. And very rightly pointed out that care of non-communicable diseases need to go hand in hand with the way we address we address the new problem. Many times when we get into such panel discussion, we overlook the achievements made in health in India. Yes, we talk of the cracks and we talk of how those cracks have been increased during COVID. But I just want to remind you of a few figures that health has been receiving a lot more attention in India for last about 15-20 years. 2005, we had one of the largest missions in the world called National Rural Health Mission, which was expanded to urban area and was called National Health Mission. If you look at the data between 1990 and today, the life expectancy of an average Indian has increased substantially. You look at under 5 mortality rate. In 1990, if you look at the absolute number, 3.3 million, 33 लाख बच्चे हर साल मरते थे. That number has come down to 1 million. If you convert them into absolute number every day, you are saving about 6,000 child lives a day. Substantial progress. You look at maternal mortality ratio, it has been reduced from 560 in 1990 to 137 in the recent years. So we have made substantial progress, but tragedies like COVID highlight the cracks we have, the weaknesses we have in the health system. So, and when you have COVID-like problems, the existing health problems don't go away. They are always there, and that's what Dr. Prabhash has highlighted. So I'll come back to you, Dr. Prabhash, with more questions. We have Dr. Biplab Das, who is a renowned neurointervention radiologist who studied in the best institution across India, and currently he heads Fortis Memorial Research Institute in National Capital Region. He has expertise in stroke treatment, brain aneurysm treatment, carotid artery disease, epilepsy, Parkinsonism, and is providing the best state-of-the-art care available anywhere in the world. And he is a pioneer in stroke telecare, and this telecare becomes even more important in current scenario like COVID. We can provide care to the people who can't get to the top facilities where neurointervention radiology is provided. With that, over to you, Dr. Biplab Das. What is your perspective on how COVID has increased the cracks we had in the system for providing care to non-communicable diseases, and your specialty, and why you chose to become a doctor? Because this week we are expressing our gratitude to all people like you and others who are in the forefront of the war against COVID-19. Over to you, Dr. Biplab Das.
So good afternoon, sir. Thanks for your kind introductions, and it's really a great pleasure to be part of with you and Himaniji as well. And so just for slight additions in that, I'm basically a neurologist actually. So I'm a neurologist and I'm doing neurointervention. So looking after, and my prime field of interest is definitely stroke, and in addition to other neurological disorders. So as Dr. Prabhash has already mentioned the current scenario, and you also rightly said that COVID is something which has come without prior notice. It is everybody is all of a sudden unprepared, and the whole world. I mean, like the pandemic is like catastrophic effect is happening, so that we can see, no doubt. But over the months, we need to realize that as we say that non-communicable disease, that is NCD. So whatever we talk, so we need to understand that the non-communicable disease burden, like which is there, and the impact because of COVID-like scenario has been magnificent. I mean, it's a very significant, I would say, in a single term. Because if you talk about non-communicable disease, just to give an idea, I mean, like how is the magnitude of the problem of non-communicable disease. So non-communicable disease for a public, I mean, like which is not transmitted by, it's not by infectious disease, but this is something where which is being either sometimes inherited from genetically, some environmental factors, your behavioral activities, and all these things predisposes to non-communicable diseases. And it's such a significant. I'll just give you idea. I mean, like this is in data from World Health Organizations, and if I'm not wrong, 2015 or something, 2019. So out of all populations, all deaths, all mortality around the world, up to 65 to 70% mortality is because of non-communicable disease. So you can imagine the magnitude of the disease burden, magnitude of mortality or death that is being caused by non-communicable diseases. And it's approximately like around 41 to 45 millions of people lose their life in a single year. And if you talk about India, it's something like around 5.2 or 5.8 millions per year. And that's not the data of 2020. This is data of 2 to 3 years back. So this is saying, so I just want to say that, there are so many non-communicable diseases which is treatable, which is preventable, and that's need urgent care in current scenario also. There is no doubt we have to fight COVID as a team, as a together, and government and everybody is doing their best. There's no doubt about that. But at the same time, we need to take care of some of the very, very important thing of non-communicable disease. Say, for example, somebody is having suffering from heart attack or stroke. These are very important emergency condition where the patient needs to be taken care immediately. This is time is very, very crucial here. That's why you have a golden time and window period you have, and patients need to be taken care within that window period. Otherwise, these patients have either mortality, or you can have a significant disability in whole their life. So that's how we need to discuss. We need to balance out in current scenario like COVID or down the line in somewhere how to act professionally, how to act in a better way, because COVID is actually exposed to the gaps as Sir was also mentioning, the cracks between the system which we need to develop over the time. We need to have an integrated approach. That's the deficit which we have. I think so. That's something which we need to take care.
Thank you. Thank you, Dr. Das. And you highlighted the global burden of disease. Globally, 65 to 70% of total deaths per year take place because of these conditions. And you rightly pointed out these conditions are preventable, treatable, may not be curable, but you get very close to having a normal life. And you highlighted that many of these conditions, when they occur, for example, heart attack, we call it myocardial infarction, or stroke, you are an expert in that. You get to a hospital in time, they can treat you so that those clots which are blocking the blood supply to part of the brain or part of the heart, they can be dissolved, and you will be back to normal life without any damage to your brain or the heart. And I will maybe further emphasize the point you mentioned about number of deaths in India. In India, about you take a crude death rate of 7 per thousand, you have about 1 crore or 10 million deaths every year. And what do they die of? They die of, if you put all communicable disease, all infections, perinatal, maternal, child causes together, they are total only 27.5 lakhs out of 1 crore. You look at non-communicable diseases, 57 lakh.
Yes,
almost double. We are giving focus on infections and maternal child health.
Agree, sir.
We are closing our eye to double the deaths which take place because of this. Among that, cardiovascular diseases alone account for same number of deaths as communicable diseases, maternal child health and nutritional diseases, which is about 26 lakh. Then you have diabetes, which is 2%, cancer 7%, chronic obstructive pulmonary disease, which is 13 lakh, and other non-communicable diseases. So very well highlighted by you, Dr. Das, that these diseases are causing a lot more deaths. But when you look at sicknesses, once a person gets infected, he is treated for a week and he becomes all right. But with NCDs, these are either with you for the rest of your life. So when you look at sickness in the community, these will be not double, these will be many more times more common than. And then these are not watertight compartments. A person with any of these conditions, COVID has shown us, is more likely to have severe disease and is more likely to die. So this COVID has again highlighted the importance of why we should be giving more attention to non-communicable disease, COVID or no COVID.
Yeah.
Because these people will then fill up all your hospital. You will not be able to provide care to those without COVID for NCDs or for other conditions. So very important points you have highlighted. Well, I'll come back to you, Dr. Das, for more input. Let me move on to Dr. Yash Javeri. And when I was looking at his CV, he is one of the brightest we have, though probably the youngest in the group. So I will call him youngest and probably the brightest in the group. He has been a gold medalist throughout. He won a gold medal in MBBS at Stanley, then in MD Anesthesia at Jawaharlal Nehru Medical College, Aligarh, again won a gold medal, and he has been specializing in critical care medicine, Sir Gangaram Hospital. He is an expert in infection control, for which he studied at Johns Hopkins University, and he has designed and conducted many courses on intensive care, and some of these courses have been recognized internationally. So I will not go into more details, Dr. Javeri. Over to you to give your perspective of how do you look at NCDs with or without COVID, and some insight into what you are doing and what motivated you to become a doctor and a specialist in critical care. Over to you, Dr. Javeri.
Thank you, sir. I will answer the questions into two parts, sir. First, what is my take on NCD as of today? And then how COVID has influenced the NCD and the faults which have come after COVID has been in place now. Sir, the modern medicine has its roots in 19th century. The roots which developed for modern medicine were mostly for infectious diseases, mostly the bacterial infections, viral, fungal, and other etiology was lesser known. And that was the base of modern medicine. With advent of anesthesia, then surgeries happened, the damage because of accidents got cured. What we generally do, we get sick, we attend a medical doctor who prescribes some medicine or performs surgery, which essentially cure our illness. But non-communicable disease do not follow this fixed pattern. There is much more to it. The etiology of non-communicable disease is not like infectious disease. There is not a single etiology. It is generally multifactorial. It is dynamic. Various factors play around while we diagnose non-communicable diseases. Where we miss non-communicable diseases? We miss the modifications in lifestyle. We miss on education of our patients. We probably miss to provide a holistic approach of education and improvement in the lifestyle, as well as other correctable modifiable factors which can probably cure non-communicable disease or prevent non-communicable disease. Now the world is plagued by a tsunami of chronic age-associated non-communicable disease. Many age-related changes like diseases, we often think it is part of the aging process, but they are not part of aging process. They also are not inevitable, but because of our lifestyle, those things, those diseases, those non-communicable diseases have been thought to be part and parcel of aging. So we often miss on these exogenous triggers, the environmental factor, the pollution, the eating habit, the sleeping habit, which are the major causes of non-communicable disease. In the same go, we understand there are multiple physiological processes which awfully go wrong while these non-communicable diseases get severe. So we fail on multiple steps till the non-communicable disease presents to us, especially if they present with the acute presentation, we have failed at multiple levels. We have failed at preventive stage, we have failed at diagnostic and even at curative stage. So what we are doing in India, we have a huge burden of non-communicable diseases. We are capital for most of the non-communicable diseases, diabetes, hypertension, cancer incidence is rising every day. And almost 65 to 70% of our mortality is because of non-communicable diseases. And the incidence of non-communicable diseases is increasing every day. Not only non-communicable diseases has its own morbidity and mortality, it also adds to morbidity and mortality of communicable and infectious diseases. Like a patient who develops pneumonia and he's in ICU if he's hypertensive, diabetic, obese, the outcomes are bad compared to a patient who is non-hypertensive, non-obese. So non-communicable disease is a big window of opportunity which has been somehow missed, and we have been not been able to target the root causes of the etiology of non-communicable disease. We needed lifestyle changes, lifestyle medicine, and we needed an advisor for the patient who can probably teach them, be a buddy, and make them aware. The concept of family physician, which was there, the family doctor, had some of the virtues of this advisor of medicine, but in modern medicine, somehow the preventive and the advisory role of doctor is disappearing. It has not been lost, but it is disappearing. Now, coming down to COVID, how COVID has affected non-communicable diseases. Most of the
Hello,
patients, yes, sir, yes,
Dr.
sir,
Javeri?
yes, sir. Most of the patients with
Yeah.
COVID who have been admitted to ICU have many comorbidities, diabetes, hypertension, obesity being the major one, CKD. The illness was much more severe in patients who have these comorbidities. The outcome was bad in patients who had these comorbidities. The incidence of CAD, hypertension, stress-related disorders, sleep disorders, psychiatric disorders have increased in last few months. The incidence of suicides has increased in last few months. The availability of healthcare providers and the fear and anxiety which they have in dealing with masses has probably hampered the care which has been provided to our population because of COVID. In the beginning, there was a lot of disarray in the provision of healthcare, but now, as time has passed down, most of us are geared better to provide care for non-communicable diseases. How has it affected intensive care? Intensive care, the presentation of most of the patients, almost 50 to 60% of the patients will have hypoxia or respiratory failure at some point of the illness. And same is the presentation with COVID. So many of the ICUs initially were very, very scared to take patients, and the patients were going from pillar to post on and getting bed in any of the ICUs. April onwards, most of the ICUs have divided themselves into suspect and confirmed cases, and they have dedicated units for non-suspect and non-COVID. So we are trying to cope up with the COVID stress. COVID is an opportunity to understand non-communicable as well as communicable diseases. Probably we were underestimating, most of us, like acute care physicians, we never paid much attention to non-communicable diseases. But now, in light of COVID, we have some better understanding of non-communicable diseases also. So this is my take about COVID and non-communicable diseases, sir.
Thank you. Thank you so much, Dr. Javeri. And you rightly described the tsunami of NCDs, which causing huge burden of disease. And I like one statement you made. Aging is inevitable. It will come with as you become senior in life. But NCDs are not inevitable. We can take action so that we can. I'll come back to you with some more questions. Let me go back to Dr. Kumar Prabhash. Dr. Prabhash, your institution where you are heading a department is playing a very important role in strengthening cancer care across the country, providing technical support, capacity building to various institutions at peripheral level. So, what do you feel the role? First is you can tell us what your institution is doing, and then you can tell us that what more can be done to improve the capacity of dealing with NCDs at institution level across the country. Over to you, Dr. Prabhash.
Hi,
Yeah.
sorry. I'll put into context. One is
Yes.
in the COVID context, and other one is in general.
Yes.
Uh, what we are doing to increase the capacity to deal with this disease has been, we have been one of those key institution training people. So if you go across the country, you will find once we estimated that almost 50% of the manpower is trained from TMH. Uh, but now a lot of institution has picked up, so it is nice to see that. But you will find people from TMH, across the country who has got trained. Apart from that, TMH, which was a stand-alone institution in the past, has been now mandated by government to open more institution. And what you see that in Mumbai, we have to open one more institution which is running now and up and running very well. In fact, the director of that institute was in the previous panel. And apart from that, we have opened up institution in Varanasi, which is around the 600 odd bedded hospital, which is now up and functioning. Uh, Apart from that, we have opened a hospital in Sangrur, which is up and functioning. And there are mandates to open in Vizag, which is again up and functioning, not completely, but up and functioning for most of the care. Two more places, one in Mulanpur, that is near Chandigarh, another one is Muzaffarpur, which is approved. So let's see in future how we are able to open it and able to provide those services. But I'll say the first part was more important, that you train people and they go to the society and they provide services in multiple part of the country. Second part is the COVID situation and how we have coped up. I'll say, request everyone in the audience to read the two papers which came from our director, one in NEGM, other one is in IJC, the detailing of how we went about it. And that time, I think it was very important from our leadership to show the way. And it was very nicely done that we had multiple ways of functioning. One, we started, we anticipated early, so our intervention started in March. We started having screening in the gate for all patients, seeing that can we screen them and find out them as early as possible. Second, we opened a fever clinic so that all the patients go to correct place if they are identified here. Third, we started calling all our appointments and telling them that and trying to have the appointment getting deferred if was not really required, trying to get in touch with the local people whom we know or we got trained from TMS to request them to meet them locally so they don't have to visit us immediately. Fourth, at the manpower level, we try to have people coming in sequentially, not all of them coming together, so that our attendance becomes limited, so that people don't they are not crowded in the hospital. Then we in the hospital also we ensured that safety practices are implemented, having the mask, having those gloves, having hand wash or sanitizer being available, having training of all those manpower which is being there. And that's the reason that I can say that these things have been very useful. And as on date, there are very few people, as far as the medical practitioner are concerned, which has turned out to be positive. We do have many people in the healthcare provider which has turned out to be positive, but medical practitioner in our hospital, there are very few which has turned out to be positive. So this is overall view how we have tried to deliver the treatment in during these times. In fact, we didn't stop the treatment. During these times, we have ensured the patient coming to the hospital, they are taken care of with all the capacity we had. So we are compiling the care provided. The surgical data is just now out, which we provided the care to our patients during these times. Other data we are compiling and which will be coming shortly. So we ensured that the healthcare provider, they are taken care of, patients, they are taken care of, and also we try to see that the patient, if possible, in the local place, they are taken care of during these times.
Thank you so much, Dr. Prabhash. And my last question maybe to Dr. Das on you mentioned that we need to focus more on prevention and then treatment of non-communicable diseases. Can you briefly tell us what a common person can do to prevent and treat non-communicable diseases? Over to you, Dr.
Right,
Das.
sir. Yes. So as I said, you also mentioned the same thing. If you talk about non-communicable diseases, this is primarily caused by non-infectious things, right? Which is because of your habit, the way you carry yourself, like the way in current scenario in urban and semi-urban, you can see that nobody is actually doing any physical activity. And environmental factors, stress. I would like to say air pollution, especially, and these are the factors which are significantly contributing to the genetic factors, because genetic factors you cannot really change as such. Somebody's having inherited some predisposing conditions which can predispose you to either heart disease or hypertension or diabetes. There is different issue. So there are some factors which is preventable, so we need to take care of this preventable, and if you take care of this one, there can be significant change, the way the statistical change and the outcome we can have. So doing so, we need to have the first thing we need to have is a comprehensive, intensive awareness program. So if we talk about awareness program, because if you say, for example, I'm more interested into stroke and neurological disorders. So if you talk about stroke things, and it is very strange, just to share with you, out of, say, for example, 100 patients who are having a stroke, hardly 4 to 5%, even not the 5%, patient reach hospital within the golden time. So within the window time. So you can imagine, so there is so much of scope left behind. So we need to do so much of work to reach to the people, that we have to do really good work and let them know that, yeah, this is a stroke. I'm highlighting why about stroke or heart attack, because here among the non-communicable diseases, here something which is emergency conditions. Other non-communicable diseases is something like which is gradually. Usually we think that non-communicable disease is something which progresses slowly over the years, and then that develops. But for this MI or cardiac thing or cardiovascular or cerebrovascular things, it is not like that. It is very acute presentations, and you have to take care very urgently, because time is brain there. So doing so, I would like to say that public awareness is very, very crucial. For making the public awareness, you can take help of the social platforms. There are so many other ways, and government is also involved for the same. In doing so, either maybe a little way is we are trying to develop a stroke awareness network or a stroke campaign. That's we are comprehensively trying to make, and one of these things is like stroke telecare mobile applications. So just to give you an idea, I mean, a stroke telecare mobile application, if you type in your Android or iPhone, you can download it free, which is free to download. So this is an initiative or attempt which is being made, where we are trying to connect with people or a stroke ready centers at a very remote area. Say, for example, very hilly remote area somewhere in Assam or somewhere in Himachal, so that somebody sitting here in an expert who is sitting in a metro or somewhere, some other place, can give an advice there itself. And the thrombolysis, we talk about thrombolysis because patients who are reaching hospitals, they need to be thrombolized within that golden time. So we are trying a way so that the thrombolysis can be started there, because these people cannot travel so long time to a metro or some other hospitals where thrombolysis can be initiated, and that's how they miss the main time. So this is an initiative for connecting the different peripheral centers, so that we can start this benefit. We can offer this benefit to a person who is staying in a very remote area. That's number one. At the same time, I'm again stressing that we need to work really hard to take this message and awareness program. What is a stroke? How to recognize a stroke? Because people don't recognize a stroke, and then that's why they don't reach hospital. If you compare stroke versus heart attack, there is vast difference between the awareness. It's because of probably because of social media, or our Bollywood is more towards heart attack, and anything which is they want to show emergency, they will show heart attack, not paralysis. The scenario is changing. At the same time, other thing I would like to highlight is in heart attack, the persons have severe chest pain, severe. It's like a severe chest pains. They simply can't ignore it, and that's how they have to reach hospitals. Okay, but whereas if it is a small stroke or minor stroke, they simply say, well, it might be because of sleep. I mean, some problem has occurred, so that's why the weakness has happened. So that's how they ignore the thing, and the time gets delayed, and the person lost the golden hour of life, I would say. And as you said, sir, I mean, Sanjiv sir, you have at the start you have mentioned, somebody's having infection, somebody's having non-communicable disease, especially emergency condition. The impact I would like to compare. Somebody's having, say, for infection, they recover. So you cannot compare the number of disease there, because infection, the person are absolutely fine after, say, for example, a week. Whereas somebody's having stroke or heart attack, somebody's having stroke, he or she not treated properly, he will be or she will be bed bound, wheelchair bound for whole life. So that, can you imagine? I mean, that's such a catastrophic things can happen, and we need to take account of that things while analyzing all these things. So that's my message. I would say. I mean, like, so it's a high time that we need to address the non-communicable diseases, because if you look carefully, the number of disease which is being contributed for the non-communicable is quite high. The burden which is being given because of these things is very, very high. So that's how. This is my message, actually.
Thank you so much, Dr. Yash. Javeri, I know you are hard pressed for time. Are you still there?
Yes, sir, I am here, sir. Yes, sir.
Okay. Briefly about, you mentioned about the impact on mental health. Briefly tell us a message for a common person, what they should do in COVID times to take care of their mental health.
Basically, first thing is we have to think apart from COVID. We have to take all the precautions for COVID, but COVID should not overshadow our thought process. This is happening. The amount of information which has been driven into common public is also huge. And the discussions about death and devastation is happening in front of children that will impact the kids. The discussion is happening in front of laymen, and they are also affected. We have some understanding that COVID does not mean death, but most of the lay people think otherwise. So this message has to be driven that is lot more to COVID than only death, and most of them will come out unscathed. Second important thing, we have to increase the awareness and accessibility to psychological intervention people, clinical psychologists, psychiatrists, and they should have awareness. There should be school psychology programs. There should be programs which are targeting society. We have to capture early signs and intervene early. And the awareness about psychiatric problems and the danger signs should be caught up early. We as colleagues also should be able to identify that this person could be tilting towards a dangerous side where he needs a psychiatric intervention. This will be my suggestion, sir.
Thank you so much. I know Dr. Kumar Prabhash, Dr. Biplab Das, Yash Javeri, you have a treasure of knowledge and experience, and we can continue to learn from you, but we have constraint of time. So with that, let me conclude. We talked about the burden of diseases, non-communicable diseases. We looked at the figure are already taking away more than double the number of people who die of infections, maternal child health, nutrition related disorder. And as we are talking, this is increasing by the day. If you look at the data over 10 years, diarrheas came down by 26%, infections by 20% as cause of death, tuberculosis by 25%, and neonatal and birth related conditions by 43%. This is what has happened. 2005 to 2016, they have declined. But on the other side, Ischemic heart disease went up by 53%. Chronic obstructive pulmonary disease increased by 23%. Cerebral vascular diseases increased by 25%. And road injuries, we didn't talk about it, though they can be put with non-communicable diseases. They went up by 25% in 10 years, and they are increasing even today. Every day they're going up. So they need non-communicable diseases, need a lot more attention. And Dr. Kumar Prabhash very rightly pointed out quality of care. The Tata Group as a whole and Tata Memorial Hospital is globally known as providing best quality, affordable healthcare. And I compliment you and your team for trying to replicate it across the country through institutions where you are directly supporting, but also building capacity of others. Dr. Das, you very rightly pointed out we don't need to worry about non-communicable diseases if we look at what can we do to prevent them. And even if, God forbid, if you have any of those conditions like myocardial infarction or stroke, you reach a health facility in time, you can have a reversible recovery and you will be absolutely normal after that. And we need to have more awareness so that people come forward to take treatment early. Dr. Javeri, again, thanks for us to telling about we have a tsunami of NCDs hitting us. And repeat, aging is inevitable. We all will grow old by age, but NCDs are not if we take proper care in taking preventive measures and timely care. And in a time like COVID, we need to take care that people don't get unnecessarily worried and scared about COVID. Mortality is very, very rare in COVID. If you look at population who has been tested, it'll probably be like any of the seasonal flus. You know, the
Right.
serosurveillance study done by ICMR, it is less than 1 in 1,000.
Yes.
But if you look at the cases reported, and that's even there, it is about 3% of those who are reported as COVID cases. So we need to take care of that. Thanks again for sharing your expertise and sparing valuable time to talk to us and to talk to the people who need to know and learn a lot more from your expertise. Thank you so much.